Vitamins you're taking each morning may be quietly hurting your heart, not helping, not protecting. Hurting. I know that sounds hard to believe. After all, you've probably been told for years that vitamins like E, calcium, and iron are essential as you age, and like many others, you've likely added them to your daily routine with good intentions. But here's the truth that most people, especially seniors, aren't told. Some of the most common supplements can increase your risk of heart failure, stroke, or dangerous arrhythmias, especially when taken in the wrong form or without the right balance as a heart doctor who's treated hundreds of older adults. I've seen this firsthand. Patients who walk into my clinic feeling fine and leave stunned by what we find. So please stay with me because in today's video, I'm going to walk you through 5 specific vitamins that could be damaging your heart silently and what you can do instead to protect it. If this topic speaks to you, leave a comment with the number 1. So I know you're listening, and don't forget to subscribe to Health 365 for weekly tips designed to help you live strong, safe, and heart healthy after 60. Now let's start with the first and most misunderstood vitamin of them all. Let's begin with vitamin E, a supplement that sounds like it should protect your heart but can actually put it at serious risk if taken the wrong way. For decades, vitamin E has been praised as a powerful antioxidant, you've likely heard. It helps with memory, aging, heart health, and more, and chances are it's sitting in your medicine cabinet right now, maybe in a bottle that says heart healthy or immune support. In fact, many seniors take 400 to 800 IU of vitamin E each day without a second thought. But here's what few people realize: high doses of vitamin E can thin your blood too much, especially if you're already on medications like aspirin, statins, or blood pressure pills. Now, a little blood thinning might sound like a good thing, especially for preventing clots, but for someone in their 60s, 70s, or beyond whose blood vessels are already more delicate too. Much thinning becomes dangerous. It can raise your risk of internal bleeding, hemorrhagic stroke, or a weakened heartbeat without you even feeling a single symptom. No headaches, no chest pain. Nothing until something very wrong happens. I've had patients come in with sudden bruising, dizziness, or even heart palpitations, only to discover that their healthy habit of taking high-dose vitamin E was quietly tipping their heart out of balance, and the science backs this up. A study published in the Journal of the American Medical Association, JAMA, showed that high doses of vitamin E over 400 IU daily were actually associated with increased risk of heart failure in older adults. It's shocking. I know, especially when you thought you were doing the right thing. So what's the safer option? Food-based vitamin E is your best friend. A handful of almonds, a tablespoon of sunflower seeds, a side of steamed spinach. These foods provide vitamin E in natural amounts balanced with other nutrients your body can use wisely if you still feel the need for a supplement. Talk to your doctor and never exceed 200 IU day unless you have a medical condition that truly requires it before you take that next pill. Pause and ask yourself, is this truly supporting my heart? Or just something I've been told to trust for years? Because sometimes the most dangerous choices are the ones we make on autopilot now. Let's talk about calcium. The one supplement almost every senior has been told to take. You've heard it 1,000 times. Take calcium to protect your bones, and it makes sense after all. As we age, our bones lose density, and the fear of fractures becomes very real. So naturally, like millions of other older adults, you might be taking a daily calcium pill, hoping to stay strong and independent. But here's the part they forgot to tell you: calcium doesn't know where to go in your body unless you give it the right directions. Without the help of another key vitamin, vitamin K2, that calcium can end up in the worst possible place. Says your arteries, that's right. Instead of strengthening your bones, It may be silently hardening your blood vessels. I've seen it again and again in my practice. Seniors come in with great bone density tests, but they're also dealing with high blood pressure, chest tightness, or even heart attacks. And when we look deeper, their arteries are stiff, calcified, like stone, and many of them were taking calcium supplements every single day. The science behind this is clear. Calcium is essential, but when it floats around without proper guidance, it can settle in soft tissues, especially the walls of your arteries. This leads to arterial calcification, a condition where your blood vessels become stiff and narrow, forcing your heart to work harder just to move blood over time. This increases your risk of heart failure, stroke, and even kidney issues. Vitamin K2 acts like a traffic officer. It tells calcium, no, not there, go to the bones, not the arteries. Without it, calcium ends up in the wrong places. Yet most over-the-counter calcium supplements don't include K2. That's not just a small mistake, that's a big risk. So what should you do instead? First, try to get calcium from food. Leafy greens like kale and collards, yogurt, cheese, sardines with bones. These sources come naturally balanced with other nutrients like magnesium, and sometimes a little K2. If you must take a supplement, choose one that combines calcium with both vitamin K2 and magnesium. These three work. As a team, calcium builds bones, magnesium supports absorption, and K2 directs traffic. And of course, always speak to your doctor before starting or continuing a calcium routine, because strong bones don't matter if your arteries are turning to stone. Let's move on to one of the most misunderstood nutrients of all, iron. Sounds like something everyone needs, right? It fights fatigue, supports energies, and helps your red blood cells carry oxygen. If you're feeling tired, it's easy to assume maybe I'm low on iron. That's why so many seniors pick up an iron supplement or take a multivitamin that includes it just to be safe. But here's the truth that rarely gets shared. Most older adults don't need extra iron. In fact, for many, it can be dangerously toxic. Unlike some vitamins, your body has no natural way to get rid of excess iron. If you take more than you need, it doesn't just pass through your system. It stays, and it builds up in your liver, joints, brain, and your heart. This slow iron buildup creates something called oxidative stress. Think of it like rust forming inside your body over time. That rust begins to damage tissues, especially the heart muscle. It can weaken the strength of your heartbeat, disrupt the rhythm, and slowly push your heart toward failure. And the worst part, you might never feel it happening until it's far along. I've met older adults who came to me complaining of strange fatigue, brain fog, joint stiffness, things they assumed were just aging. But when we looked closer, they had iron overload caused by years of unnecessary supplementation. There's even a name for it: hemochromatosis, a condition where too much iron slowly poisons your organs. Some people have a genetic version, but many develop it just by taking iron without needing it. So here's the golden rule. Never take iron unless your doctor has tested your levels and confirmed a deficiency. That means checking ferritin iron saturation and total iron binding capacity. Not just assuming based on how you feel. If your iron levels are fine, taking more won't boost your energy. It will quietly harm the very organ that's working hardest to keep you alive. Get your iron from food instead. Spinach, lentils. Eggs and lean meats provide gentle, balanced amounts. And if you ever do need an iron supplement, your doctor should guide the dose and monitor it carefully. Now let's talk about something that sounds so innocent, it's almost never questioned: vitamin B6. You'll find it everywhere, in sleep aids, energy boosters, memory pills, and multivitamins marketed specifically for seniors. It's often promoted as natural, safe, and essential for brain and nerve function, and that's not wrong in small amounts. B6 is important, but here's where things get tricky. Too much B6 doesn't just stop helping, it starts hurting over the years. I've had many older patients come in with complaints that are easy to dismiss as just part of getting older. Tingling in the hands or feet. Unsteady balance weakness, occasional heart flutters that come and go. They'd been told it was nerve aging or maybe just anxiety. But in many cases, when we really dug into it, we found the true culprit hiding in plain sight. High doses of vitamin B6, unlike some vitamins that flush out easily. B6 can accumulate in your system over time, especially if you're taking more than your body needs every single day. And when that happens, it can begin to damage the protective sheath around your nerves. A condition known as B6 toxicity. That's what causes the burning numbness and nerve weakness so many seniors struggle with, but it doesn't stop there. B6 in excess can also interfere with the electrical signals that keep your heart beating in rhythm, that can lead to palpitations, skipped beats, or even dangerous arrhythmias, especially when combined with other supplements or medications. And most people have no idea this is happening because they assume more is better. The recommended daily amount of B6 for adults over 50 is just 5 to 2 milligrams, but some supplements contain 10, 20, even 100 milligrams per dose. And when you add up multiple pills, fortified foods, or energy drinks, the total skyrockets without you realizing. So what's the safe way forward? Focus on food-based B6 from gentle nourishing sources like bananas, chickpeas, tuna, and fortified cereals. And if you're considering a supplement, have your levels tested and never take high-dose B6 without a doctor's supervision. Remember, your nervous system and heart become more sensitive with age. What you could tolerate in your 30s or 40s might now cause symptoms you don't associate with a vitamin at all. Now let's talk about one of the most common supplements of all, the multivitamin. Walk into any pharmacy or grocery store and you'll see rows of boxes labeled Heart Support Senior Vitality or 50. B+ Essentials. They promise energy protection, clarity, even longevity, all in a convenient little pill. But here's what no one tells you. Many of these so-called heart health multivitamins are packed with ingredients that can quietly harm your body, especially your heart. As a heart doctor, I've seen it more times than I can count. Seniors come in with unexplained dizziness, irregular heartbeats, elevated blood pressure, or liver strain. They're eating well, exercising, taking their vitamins religiously. So what's wrong? When we dig deeper, we find a common thread. Multivitamins loaded with hidden stimulants, megadoses, and herbal blends not designed for aging bodies. Let me give you a few examples. Excess niacin vitamin B3 can cause flushing. Sudden drops in blood pressure and liver stress, especially in high amounts. Green tea extract or ginseng, commonly added for energy, can spike your heart rate, raise blood pressure, and trigger arrhythmias. Vitamin A in large amounts can become toxic over time, causing dizziness, nausea, or even long-term organ damage. And here's the worst part, you often won't even know what's inside these pills. Hide ingredients. Under vague labels like proprietary blend or natural complex, it sounds safe. But your body, especially your heart, doesn't care what the label says. It only reacts to what's actually inside. As we age, our hearts become more sensitive. What might be harmless in your 30s can turn dangerous in your 70s. That's why the rule more is better no longer applies, so what should you do? Keep it simple. Avoid multivitamins with long ingredient lists or energy claims. Choose products with transparency, modest dosages, and no unnecessary herbs. Most importantly, bring your supplement list to your doctor and ask, do I really need all of these? Because your heart deserves more than a flashy label. It deserves care, clarity, and a little less clutter. Now that we've uncovered these 5 hidden dangers, you may be wondering, What should I take instead? What nutrients are actually safe and helpful for seniors? Don't worry, we're getting to that. Let's wrap up with the vitamins that truly support your heart as you age and how to use them the right way. So here are 3 supplements that truly support the aging heart: vitamin D3, especially important for older adults who stay indoors or live in colder climates. It supports blood pressure, regulation, immune health, and helps protect both bones and heart strength. Many seniors are low on D3 without knowing it, so a simple blood test can guide safe supplementation. Magnesium, often overlooked but essential for keeping your heart's rhythm steady. Reducing muscle cramps and improving sleep. It's especially helpful if you've ever experienced heart palpitations or anxiety. Magnesium also helps regulate calcium movement, supporting both bone and vascular health. Omega-3 fatty acids, ideally from fish oil or flaxseed oil. These healthy fats reduce inflammation and improve blood vessel flexibility. They help keep your arteries smooth and your heart pumping efficiently, and studies have linked them to a lower risk of heart attack and stroke. But here's what matters more than the label on any bottle. No supplement will ever replace a healthy lifestyle that means moving your body daily. Even just a walk around the block. Eating real whole foods, full of color and nutrients, sleeping deeply. Managing stress and staying connected to people who care about you less is often more, especially when it comes to supplements. The goal isn't to treat your body like a lab, it's to support it like a garden with attention, intention, and care. And finally, I want to leave you with this. It's never too late. Not at 60, not at 70, not even at 90. Your heart is incredibly resilient. Even after years of stress or misguided choices, it still wants to heal. But you have to give it the chance. So today, I invite you to take that first step. Review your supplement list, ask questions, talk to your doctor. Choose with intention. Your heart has been with you every single day of your life. Now it's your turn to show up for it with wisdom, care, and courage. If you found this video helpful, leave a comment with one below, and don't forget to like, share, and subscribe to Wise Health for more practical health tips designed just for you. Because you still have so much life to live, let's make it a strong, clear, and heart-healthy one together.